All right, well, I'm pleased to welcome everyone to the our Facebook Live Power to the People Squared debate format. Tonight with me I have two distinguished candidates. We have, in alphabetical order, Mr. Alan Buckley running as an independent. Say hi, Alan.
Hey, how y'all doing?
And we have myself. I'm Brian Slowinski, your host. I'm running on the Libertarian Party ballot, as well as I've been recommended by the Constitution Party. And then we also have, on the Democratic side, we have Richard Dean Winfield. Say hi, Mr. Winfield.
Hello, everyone.
Hello. Format's going to be quick and easy. We're just going to basically give ourselves 2 minutes each. I'm going to be fairly liberal since there's only a few of us. 2 minutes, who you are and why you're running for office. And then after that, we'll get into our main subject. So we'll go opposite this time, since I went alphabetical that time. Richard, Mr. Winfield, you first, sir. 2 minutes, who you are and why you're running.
Okay, my name is Richard Dean Winfield. Since 1982, I've been a philosophy professor at the University of Georgia. My wife of 38 years, Sujata, hails from India. She's currently now an immigration attorney. We have 3 children who went to the public schools in Athens. I'm also a member of the union that's attempting to organize all employees in the state university system. I ran for the U.S. House of Representatives 2 years ago on a platform similar to what I'm running on today. Now I'm running in this special election to bring to Washington the fight to have our social rights recognized and enforced. These are rights that our Constitution says very little about, yet they're crucial if we're going to be able to exercise any of our freedoms and also to be able to participate as an equal with our fellow citizens in self-government. Among these social rights is the right to healthcare, which we're going to be discussing today. And I think if our government is going to be the guardian of our freedoms, as I think all participants in this debate would agree, it has to provide for those fundamental rights that are crucial to exercising any freedom whatsoever. And that is particularly true of the right to healthcare. If you have no access to the resources that allow you to stay healthy and to have a decent longevity, then all of your freedoms are at risk and in jeopardy. And today in the United States, we are facing what I consider to be a very mismanaged pandemic. We were very vulnerable to it because of the failure of our healthcare system to really provide proper health coverage to everyone. And our ability to respond has also suffered by the fact that we really don't access proper healthcare to everyone. And we have a system that has costs that are completely out of control, that are twice as much as those in any other country. And I think we need to do something about that. And there will be immense savings if we do. So thank you.
All right, thank you, Mr. Winfield. I'll go next. Can you guys mute your microphone? Others are going to have, please. Okay, my name is Brian Slowinski. I'm the Libertarian Party candidate. I've also been recommended by the Constitution Party for this seat. I am the third party consensus candidate, the fusion candidate, who's doing his best to try to bring everybody together. The whole problem with our elections right now is that we're picking sides. You have the red side versus the blue side, and the red side could have one of the senators or representatives could have $1 million idea, and the blue side would just say it's wrong, or vice versa. And that is just wrong, because everybody's the master of something. We need to learn from everybody. So my suggestion is if I'm honored enough to be voted in as a senator, I would go up to Washington, D.C. to work with everybody, but I also will make sure that everything that is done up there is constitutional and working towards what we need to do for this country, which is get back to the Constitution of the United States of America and start actually producing a budget and doing what we said we would do. You can get a hold of me at voteslowinski.com. I've sponsored these debates because I believe that we need people in Washington, D.C. that have the gravitas to be able to speak beyond a 30-second soundbite or a focus group answer. We need to be able to actually talk policy. We need to talk back and forth and be civil towards one another. And the more we're able to do that, the better off this country will be. Thank you. Alan, you're next, sir.
Yes, Alan Buckley, independent candidate, run 3 times before as a libertarian, as a moderate libertarian. Last time I came in at 162,000 votes, 1.7%. That was 2016. I'm a fiscal conservative, and my campaign slogan is "Say tomorrow, make tomorrow as good as or better than today." Our government financial organizations, including the Congressional Budget Office, that's the CBO, and the Government Accountability Office, that's the GAO, have both said for years that our system is not sustainable. They always unsustainable. So let me just, as they say, a picture tells 1,000 words. I have a chart here that'll tell 1,000 words rather than me babbling on. Hopefully you can see this, but this is a chart of where it's headed. And let me see if I can get that all in. This is what the debt spiraling out of control looks like. You can see where it's headed. That you can see it's over here. It's headed off the chart, and that's basically the end of the world as we know it. So I don't know how well you can see that, but it basically shows what the debt spiraling out of control looked like. And why is that important? Because the debt spiral out of control, none of the other issues matter. And we're talking within the next decade, things are going to get very ugly. The Fed is already printing money, and that's going to be inflationary. It makes CDs and other short-term investments imprudent investments. And basically our system doesn't work on a long-term basis. And I'm not saying this to brag, but I'm the only candidate who offers solutions to make our system work on a long-term basis. And it involves sacrifice, the better tax system, reforms to entitlements, and reducing our foreign military presence of 800 foreign bases. So, website is buckleyforsenate.org, and reducing healthcare costs are part of the equation of making the government work long term. Thank you.
All right. Thank you, Alan. Thank you, Richard. Okay, now we're going to get into the main portion of the debate. You guys can hear me okay?
Yeah.
Yes.
Okay. We're going to talk about HealthCare and health insurance. That's a big part of the budget, especially Medicare, Medicaid, and the people want to know where we stand on issues and how we would vote, or what we would do to resolve this situation. So let's see. Alan went. Let's see. Richard went first last time, so Alan, can you go first this time, sir?
Yeah.
5 minutes. Healthcare, health insurance. Be your own timer. Just be reasonable, because there's only 3 of us. Go ahead.
What are the good points of our current system? You have choice. You can go to the doctor you want to see. We generally have excellent service for those who can afford it through insurance or otherwise. And we have a system of competition where better providers get more business. They see more patients. I know when my wife was pregnant, via word of mouth, we ended up using a certain doctor, which almost turned out to be disastrous. But in any event, he had lots of business because he had lots of referrals. And generally, you don't have to wait
Testing.
Something went wrong there.
There, Alan?
Yeah, something went drastically wrong.
Yeah, the whole thing. Richard's trying to get back in too. You literally started up about a minute and a half into it, all of a sudden it froze up and then just went away.
What was the last thing I said, you know?
It was right after you showed the chart.
Oh, wow, that's right up to the beginning.
I'm sorry.
All right, I'll just go back to work.
You ready to go, or you want to see if we can get Richard in first?
Yeah, I'm ready.
Okay, why don't you just go ahead, I'm sorry, and go from where you're at, sir, or wherever you want to go from.
So we didn't get into healthcare at all, is that right?
No.
Okay. So we're just finishing up our opening statement.
Yeah,
Is that right?
no, actually, you were just starting the healthcare thing. You were showing.
Oh, okay.
You were doing your healthcare thing,
Okay.
but then it just kind of like froze up and then just went.
Okay. Did I mention the good and bad parts of healthcare in this country? Or did I go through that?
You just started a little bit of that. So you're.
Okay. The good things about healthcare in the U.S. We have choice. You go to whatever doctor you want. In general, we have excellent service if you can afford it and you have coverage. We have incentive for providers to provide better service because they get more business through word of mouth, etc. And we generally don't have long waiting lines to get an operation, etc. But the bad things about our system are cost, and lack of universal coverage. So how do we keep the good things and eliminate the bad things? Well, there's two ways to do that. One is we can go to socialized medicine, Medicare for all, whatever you want to call it. Or we can reduce the impact of the third party in the healthcare equation, make it more like going to a restaurant, buying a car. And there are two areas in our system where there's a third party in the equation that are very obvious: healthcare and college costs. And the inflation rate for healthcare and the inflation rate for college is virtually always greater than the ordinary inflation rate. So we got to reduce the impact of the third party to get costs to come down. It's not going to happen with Republican candidates. It's not going to happen with Democratic candidates because their parties to drug companies and health insurers, and they just can't get anything done. They're not going to get anything done. So as an independent candidate, I think I'm appealing in the sense that I understand the problems and I would have the ability to act to overcome them. Who's making all the money in the current system? Mainly health insurers, hospitals, certain doctors, and drug companies. As far as drugs, Art Gardner, a patent attorney, who I happened to run across today, coincidentally, spent an hour at his house, said that in 2014, just really bizarre. But anyways, came up with this idea that give drug companies a choice. Either don't charge more in the U.S. You have a choice. Either charge no more in the U.S. and you charge abroad, or lose half your patent life. So you choose. If you want a full patent life, you can't charge more here than you charge in other countries. I think that's a great idea, and we need to stop make illegal pay-to-delay practices where generic drugs are kept off the market by the name brand companies, basically buying them out, paying them off to keep their generic drugs off the market. I'm in favor of changing Medicare and Medicaid. Medicare basically moving the retirement age to 60, from 65 to 70, while keeping Obamacare available so those people who are between 65 and 70 can go into Obamacare. And of course, Medicaid is also available to certain people. But I do propose keeping Obamacare, but changing it. And on my website, I'm a participant in Obamacare. I've been a participant for about 5 years. Roughly 1/30 of the population participates in Obamacare through individual coverage, and I and my family are in that 1/30. So I do recommend some changes to it. But as far as, for instance, Medicare, as far as reducing cost, I recommend we eliminate tax subsidies for any health insurance other than high deductible insurance and HSAs. Things have been gravitating that way. More and more people are going to HSAs and high deductible plans anyways. But right now there are tax subsidies available for all sorts of health insurance. So, and I recommend changing high deductible plans so that the deductible can be as low as $0 instead of what it is now. I think it's $1,400 for an individual and $2,800 for a family. It can be as low as $0 as long as the co-insurance that's paid by the individual, the participant, is at least 50% until you get to the annual maximum, which is for individuals. This year, it is $6,900 and it's $13,800 for a family. So, and I also specify that in no event can co-insurance be less than 25% under a plan. So there's skin in the game, but nobody gets broken in the process. And we have incentive for people to control costs. Where are healthcare costs under control? Where do you see competition? Think LASIK. Think cosmetic surgery, where you see those commercials on the radio and on TV because they're competing. I had a colonoscopy last Tuesday. I told Brian about it. It was really thrilling. But you don't see the advertisements for colonoscopies on the TV, fortunately for all of us, I think. But my point is, you don't see advertising for medical care in general because there's no competition. But you do see advertising for things like LASIK and cosmetic surgery because it's not covered. But I have an article on my website that talks about Singapore. It's called The Real Market in Medical Care. I highly recommend people read it. It says that Singapore spends about 5% of its GDP on healthcare. We spend about 18%. We're the highest bar. And some of the things they have are just the things I just mentioned. They have price transparency. They have health savings accounts with high deductible health plans. And they have an overall safety net for somebody who has a very big cost, and I'm not opposed to that. But it says, anyways, that's what works, and it would work here. And what's preventing it from even being brought up is just the fact that the two major parties have sold out to the major insurers, health insurers, and drug companies. And we're not going to make traction unless we can get beyond that. And let's face it, healthcare is huge. I mean, it impacts so many people, and it impacts so many people negatively, and we have to fix it. But like I said, I don't think it's going to happen with the two major parties in power. So adding more to that problem by throwing more people, Republicans and Democrats. I know Richard's running as a Democrat, but they're not going to get it done because they haven't gotten it done. The Democrats have the top put in Obamacare. They could have done something really good along these lines, but they didn't. And why do they keep insurers so prominent in the equation? Because they sold out to the insurance companies. The insurers came through that Obamacare pretty well. So did hospitals. Again, they have strong lobbies, and that's the reality. If an independent person, independent candidate, I would have the ability to propose solutions, bills like a Financial Sanity Act that actually would push back the Medicare and over retirement age. And one other thing I'll mention is for Medicaid, I think states should lose funding if they have certificate of need laws. Certificate of need laws are basically laws that say if you want to put in a new healthcare provider in a certain area, you need to get a certificate of need. You have to go to the state and say, hey, there's a need for, my service here because there's not enough providers. Well, you don't see Walmart doing that or Target. They just figure out where they think that they can get enough business. And so these certificate of need laws, having worked at law firms for many years, I've seen the fights that go on between those who have market share and don't want to lose it, and those who want to grab market share. And these are major court battles, and they're extremely costly. And of course, lawyers make money, and I'm not a certificate of need lawyer. But finally, for Medicare, I suggest we cut the Part B premiums in half, but have the co-insurance percent go from 20 to 40. So similar to high deductible health coverage in the private sector, there's incentive to control costs, but nobody gets wiped out, nobody gets hurt tremendously. For Part D, Medicare, I say basically keep catastrophic coverage, which covers costs of roughly in excess of $7,000, 95 at a 95% rate. But if we get drug costs to come down via the methods I mentioned, then that solves a lot of the drug problem. So I've gone on and on, but that's the nature of the beast. Sorry, thank you.
All right, thank you, Alan. Appreciate it. Annette Davis Jackson, you're with us? Unmute yourself. Annette?
I am, sir.
Okay, you have 5 minutes where you stand on HealthCare and health insurance. Go ahead, 5 minutes. Go ahead, Annette.
Hello, sir.
Yeah, you hear me?
Hello.
Can you hear? You guys hear her?
I can hear you, yes.
Annette, you hear me?
I hear her.
You hear me, Annette? Annette. She dropped. Okay, I'll go next. Since I'm next in line. Mine's going to be short and sweet. My main advisor is my wife, who's a doctor. She's very, very smart. She's actually boarded in anesthesia, pain, and critical care. We have discussions all the time. We go back and forth. She's a little bit more on the Democratic side than I am. But we do talk back and forth and talk about ideas. My whole thing is the Obamacare thing knocked a lot of people off insurance. You had President Obama, talk about if you like your doctor, you can keep your doctor. Nothing could be farther from the truth. A lot of people lost their insurance, saw their rates totally go sky high. Like Mr. Buckley said, I think third party payer is not the way to go. So I think we need to get away from the Medicare Medicaid model and get back to more of a direct pay type of health care like we used to do. And I would instead suggest that we send the money for Medicare Medicaid, we grant it back to the states and allow them to do a little more experimentation with that to cover their citizens. And by what I mean by experiments is you could do something where you could set up small clinics in more rural areas, so a better chance for your everyday things to get a prescription or get seen for smaller things, and everything else would be basically sent up to more of a regional type hospital. I would also suggest that we get away from health insurance that covers everything and make people responsible so they have skin in the game, so they're paying for their prescriptions. They're paying for their small visits, whether it be like for the flu or a cold or anything like that. But anything that's catastrophic, then we need to work on having people go back to having catastrophic insurance that will cover people if they have a stroke or heart attack or a car accident or some disease that is totally decimated themselves. And I think if we get back to more of that kind of thing with the catastrophic health insurance, and get more where people have skin in the game, where they're not gonna, you're not gonna have the, it costs, let's say it costs $200 to have it done here, but because when they hear that you have such and such insurance, all of a sudden it's $1,200 they're gonna charge the insurance company. Well, you wonder why we have runaway costs. That's one of the big reasons right there, because there's nobody paying attention to this stuff. And that's one of the reasons why you have a lot of denial of services as well through insurance companies, because they want to make sure they're not getting raked over the coals when it comes to covering their people who are paying in the insurance. And that's why we need to have more skin in the game, more of a direct pay type thing, and then get health insurance back to where it used to be, which is covering catastrophic illnesses. That's kind of where I'm at. And obviously, like I said, obviously I would, my wife would be my biggest advisor on this, because she knows healthcare backwards, forwards, and sideways. Not only that, but she's also a physician in the military as well, and she's actually in the process right now of combining 2 hospitals into one. So she knows what she's doing, and I would rely heavily on her expertise in that area. Thank you. Mr. Winfield, go ahead, sir.
I'm sorry, I couldn't hear what was going on before, so I may say things that I might not have said if I had heard exactly what everyone had been saying earlier. But I think we all know that our healthcare costs are way out of line with those in other developed nations. As Alan was saying, we spend, I think it's about 20% of our national income on healthcare. We spend over $10,000 per capita, twice as much as any other developed nation. Not all of us are covered. The results are worse than other developed nations in terms of longevity. We also have a rather shameful gap that exists nowhere else in the developed world between the longevity of rich and poor, which is almost 20 years. Now, I think we're aware that the other nations that have managed to provide universal health care have used various different methods for doing so. Some have used a national health service. The UK is an example. They actually are spending less per capita than any other nation. They managed to cover everyone, and the results are better than our own. Most other nations use regulated multiple insurance plans that are required to be nonprofit. A few nations, actually only 2 that I know of, Taiwan and Canada, have a single payer system. But I myself, I think that a single payer system is the most cost efficient and fair way to go in the United States for the following reasons. A single payer system ideally should first of all separate insurance from employment, health insurance. And that has been very bad for both business in the United States and employees. Obviously, if you lose your job, you're facing not only a lack of income, but a lack of healthcare coverage, which can be disastrous, especially in a pandemic with increasing unemployment. It's bad for U.S. business, as we saw with what happened to our auto industry, which got hammered in competition with the likes of Japan and West Germany and other nations, where healthcare costs were covered by a national plan. The employers did not have to pay into it. Our employers were at a great competitive disadvantage. If we have Medicare for all, it should not be like the Medicare we have currently. It should be a single payer system that covers all necessary physical, mental, dental, and long-term care. It should have no co-pays, no deductibles. And one of the reasons for that is there are many people in this country who have health insurance, but they can't afford the co-pays and deductibles. Also, they can't afford the premiums. So if we really want to be ensure that everyone is able to have the health care they need, irrespective of their income and wealth, we have to have a single payer health insurance that will have no co-pays, deductibles, and cover in a uniform way all decent health insurance. Secondly, a single payer healthcare system provides complete freedom with regard to what healthcare providers you go to. We all know that that's not true of for-profit health insurance providers, who often will restrict both what doctors and hospitals you can go to, as well as what medications you can use. But a single payer healthcare system is completely open. It also, unlike a national health service, allows us to make use of the existing market of healthcare providers without having to make any huge public investments of any sort. or diminish the workings of competition that are operative in the provision of healthcare. Thirdly, by having a single-payer healthcare system, we avoid all the bloated overhead costs of competing for-profit insurance plans, which, far from being efficient, have extra costs for advertising. Of course, they have their super CEO salaries. They're paying dividends to stockholders. They're imposing tremendous operating costs on healthcare providers, which we all know of when you go into any doctor's office and see the clerical staff that has to cover this huge cornucopia of different kinds of healthcare plans. We eliminate all of that. And it's no accident that Medicare, as it currently exists, is much more efficient in overhead costs than any private for-profit health insurer in the United States. Fourthly, if we have the single-payer healthcare system, we are in the strongest position to bring down costs because we can negotiate as one with healthcare providers and pharmaceutical companies to negotiate fair prices that reflect the actual cost of production and put us in line with the healthcare costs of every other developed nation, which means we can cut our healthcare costs in half. Instead of having 20% of our national income spent on healthcare, we can spend 10%, which means we save $1.7 trillion a year. It's for the sake of our freedom to choose whatever healthcare provider we want. It allows us to cut costs as much as possible. It provides universal coverage for everyone. No longer will the biggest cause of bankruptcy in America be healthcare costs. No longer will there be this obscene divide, this obscene longevity gap between rich and poor. And we can do this immediately. We have the infrastructure in place. We already have Medicare and Medicaid, which can be transferred and brought into a single-payer system. We can make use of employees in the for-profit health insurance industry if we want. And this eliminates all of the problems that have plagued us when we've relied either on for-profit health insurance or on the Affordable Care Act, which does not cover everyone, does not eliminate co-pays, deductibles, does not cut costs, and has failed to really allow healthcare to be something to which we actually have a right that is enforced. Thank you.
Okay, thank you, Richard. Go, Alan, hang on a minute. I gotta see if Annette is here. She's might tried to sign in. Annette, are you here? Can you hear us?
Yes, I can hear you.
Okay, go ahead. 5 minutes on your position on health care and health insurance. Go ahead.
Well, healthcare, first of all, we have managed care versus healthcare. Doctors really ought to go back to school in the area of nutrition because most patients are void of vitamin D, potassium, they're dehydrated. But I want to talk about Medicaid and Medicare, and I want to talk about fraud, waste, and abuse. There is so much fraud, waste, and abuse in the system that is driving the cost up. According to, I think, Government Accountability Office, there's something like 28, 29 billion that is waste that doctors are billing, even duplicate billings. And I believe that if we handle fraud, waste, and abuse, we will make sure that our citizens in the healthcare, not managed care, are taken care of very properly. I believe that, and of course, I wrote a hypocritical oath for doctors. I don't believe that doctors are as committed today to solving the ills of a patient. I believe they're more concerned with profitability. And they need to take a lie detector test now to really decide, are they going to save a life or are they the demise of a life? That's it.
Okay, great. Okay, Alan, you had a question or something? You go ahead and chime in, Alan.
Say a few things. I think most people would agree there's really two ways to go about this. One is, Richard's way, which I don't, there's some problems I see in what he says, when he says we can just switch over right away. Well, for 20 years, I did legal work for HCA, HealthCare, Hospital Corporation of America. It's changed its name a few times, but they were the biggest hospital company for many years. I don't know where they stand now, but they got a lot of stockholders, and you're not going to just come in and say, well, guess what? You've had a good ride, but now your stock's worthless. So either somebody's going to have to buy that stock to get a hold of those hospitals and make them public facilities, because it sure as heck would be awfully unfair to say this is now part of the czar's asset depository. So just to say we're going to switch over overnight, I don't think that's realistic. One other thing, just so people know out there, if you lose your job, you can get either COBRA, which generally goes for 18 months, can go longer, or you can get Obamacare. And a lot of people don't know what Obamacare is. It's just regular health insurance provided by health insurers that if you buy it through the exchange, which is the federal exchange, is an 800 number. You just Google Obamacare and Affordable Care Act, will come up. And if you buy it through the exchange, basically, if you're not wealthy, if you're middle income or below, if your AGI, adjusted gross income, is 400% or less than the federal poverty level, which for a family of 4 for this year is roughly 100 to 105,000. I don't remember the exact number. If you're under that figure of adjusted gross income, you qualify for premium subsidies. And premium subsidies means the government pays part of your healthcare premium. And if your AGI is you have to have at least AGI at least 100% of the federal poverty level, which for a family of 4 is roughly 26,000 this year. So if you're over 100 and just over 100, 90-some% of your premium will be paid by the federal government. If you're at 400 or just under, it's not like very little of it gets paid. In my book, I said it was like $4,800 of premium credits are available to somebody who's at 399% of the federal poverty level. And once you go to 400.1, it's 0 premium credit. So, I think that of the two ways to go about this, I think Ryan and I are closer in terms of our thought processes. I just believe in competition. Richard, with your position that you have your choice of doctor, well, I don't know if you heard this earlier when I was speaking, or if I got cut off before I said this, but my wife, when we had our first child, we went to this certain physician who a number of her friends recommended. Well, he was overloaded with work, and he almost made a major mistake with our family unit that would have prevented my first daughter from being born. Unfortunately, he caught it at the last second. But I told my wife, this guy is so busy that he's just dangerous. And, so we didn't go to him for our second child. So I think if you have a situation in, the plan Richard talks about, the doctors in demand are going to see a tremendous amount of demand, and the ones who are in less demand are going to see a lot less. So my question is this: when I was in Russia in '96 for the first time, I was on a tour, and I asked the woman, I said, what happened in the old system if 2 people worked the same job, one did nothing and the other did a lot of work? Did they get the same thing? Yes, they did. I said, that must not have worked well. And I know that wouldn't work well here. So I guess my question is, what do you do about that? Richard, are you saying that the ones who are really busy are going to make a lot more than the ones who aren't really busy? Are they going to be put on a sliding scale? One last thing is, I read an article about going to a system like you mentioned. This was in 2008, but it hasn't changed much. You need to raise taxes by roughly 50% to go to a full-blown, socialized medicine system. So let's be honest about it. And but my question to Richard is, what is your plan for the doctor who is outstanding and has all sorts of, people wanting to use him or her, and are they going to just basically say, no, I'm only going to do X number of patients, and they go to, Sam over there who nobody likes, or go to Sue over there who nobody likes? Tough. I mean, how is that going to work? That's my question.
Could I respond?
Go ahead, sir.
Yeah. First of all, one thing regarding the the transition. Keep in mind that with a single payer health system, you don't have to make any changes whatsoever with regard to the healthcare providers. That includes doctors, hospitals, clinics, nurses, but also includes pharmaceutical producers. It's not as if any of the stockholders of this part of the health industry will be suffering anguish, because all of that will be left in place. There will be no need to have any public investment or costs in changing any of that. And that also applies to the question of there being certain practitioners who are more popular than others. That's going to be true under any system whatsoever. And obviously not everyone can go to the same doctor. They have a limited amount of time that they can spend with their patients. And so either you're going to wait for longer or you'll go somewhere else. And that's true in any particular system. One thing with regard to the problem of having healthcare coverage tied to employment is that even if you have access to COBRA or certain benefits from our current ACA system, you have to take into account that when you lose your job, you may not be able to find another job. You may either have no income or the reduced income of a limited amount of unemployment insurance. Whereas in a single payer system, you're going to retain your health insurance, no matter what your other circumstances. And if we really consider it a right, that's the way it should be. And in terms of the cost, keep in mind, we want to have as an aim, having our healthcare costs be in line with those of other developed nations, which have outcomes better than ours, and there's no reason why we can't aim to cut our costs in half. And that means we're not going to be spending more of our national wealth on healthcare. And it's not a question of worrying about billions of dollars of fraud. We're here talking about $1.7 trillion of savings that we can aim for, because that is what other nations are doing. And remember, many of them are buying pharmaceuticals and equipment from the same producers who operate in the United States. So I think we can avoid all of these problems. And keep in mind, when you speak about there being two solutions, the solution I'm offering is really one of three major ways that nations have gone that have offered healthcare to everyone. Some have taken the route of our veterans hospitals, namely a national health service that Britain adopted. Others have taken, and most others have taken, the way of having multiple insurers, but they are all strictly regulated, they are all nonprofit, and they do it perfectly well. I think that involves some extra costs in terms of having to deal with multiple types of health insurance. I think we can really cut to the bone if we have a single payer system. And all the different varieties of publicly instituted universal health care, whether they use multiple insurers, a national health service, or single payer insurance, they made the transition very quickly. They did it in a year in all cases, and they managed to do it successfully. And I think we can do it as well. Remember, when Medicare was introduced, we didn't wait years for it to go into place. It happened. When remember, Bismarck is the first one who introduced any kind of a national health scheme, which he did in 1883, and sort of set in motion efforts by nations to try to take care of the health care of their populations and not rely simply on the market, which was not either covering everyone or providing affordable health care to everyone. And it's possible to take public action. It's a question of political will, I think, rather than a technical problem.
I just don't see how you're saying that all these private providers, like I said, HCA Healthcare, my old client. And incidentally, I think the VA has failed in a lot of ways. We should we should basically expand the rights of people who are veterans to go out and get private care along the lines of Medicare. And we need to expand on that. But let's take HCA for example. And now, I don't want to take up too much time, but you say there wouldn't be changes. If the government's going to say this is what you're going to get now per night or per procedure or per use of the room or whatever, how is that not going to drastically impact what they've been doing, which is I'm not saying things need to be changed substantially. I've already outlined how I think that they need to be changed. But I don't understand how overnight that's not going to either cause their stock to go to worthless, and you've got a lot of losers. How do you make this transition where it's all just government run or government owned?
It's not government owned. None of it is government owned. And it's not directly managed. I mean, remember, private health insurers already put the squeeze on healthcare providers and tell them how much they're going to pay them for services, right? That's already happening, and happening in a way that I think it produces all sorts of inefficiencies, because it's not just one health plan telling them this is what you're going to be paid. It's 100 different health plans telling them this is what you're going to be paid, and it'll be different according to the plan.
Well, there are conflicts. I've seen doctor groups sort of unionize, form together to get leverage with respect to a Blue Cross in a particular state. Again, I still don't understand how this is how HCA, for example, big hospital chain, are they basically going to just be forced to use their beds or their rooms for the government? Explain that. How does it overnight work?
It's not the government. I mean, think of Medicare. People go to these hospitals, are covered by Medicare, just like they're covered by any private insurance plan, right?
Are you saying
In both cases, there's kind of a, let's say, a negotiation going on in effect with regard to what insurers, be they public or private, are going to pay the healthcare providers, and in our current situation, how much is going to be left to be paid by the patient. So by how much is not going to be covered, and how much the healthcare provider is still going to charge them.
So you have a one consumer then who's going to tell all the providers this is what you're going to charge, or you're not going to participate, which means
they'll be negotiating because they have to stay in business, right? They have to be able to function. They have to have a decent livelihood, and that's what's happening in Canada. That's what's happening in Taiwan. That's what's happening in all of the developed world.
I think
healthcare providers are not going bankrupt. Doctors are not making a poor living. They're doing fine.
I think what I suggest, going to Singapore will better, but I don't want to consume any more time.
Sure.
Let's see. Annette, are you there? Would you like to chime in? Annette, unmute yourself.
Yes, I'm here.
Go ahead. Would you like to chime in on any of this?
Yeah, I did.
Go ahead. Go ahead, Annette.
We're still talking about Medicare, right?
Yeah, were you listening to Alan? You there? Hello? Are you there, Annette? Annette?
Hello?
Can you guys hear her? I hear her.
Brian?
You guys hear me, but she doesn't hear me for some reason.
Hello?
Hello, Annette. Having a problem with her phone. There must be a glitch in this software, because obviously we all got knocked out. Well, again, I believe we do need to have health care, but I believe we need to do it through competition. And what better way? That's the reason why I suggested that we block grant Medicare, Medicaid back and put it back on at the state level, because that's where those decisions should be made anyway, not at the federal level. More and more government you have, the more and more layers you have, the less efficient it's going to be. I'd rather have it more closer to the consumer, and get back to more of the catastrophic type insurance, and then basically have get back to pay for services where the actual doctors will actually say, hey, it costs, let's say it costs $5,000 to deliver a baby. This is what it's going to cost you. So that would be that's where I'm kind of coming from. I realize there's inefficiencies and efficiencies in every system, but Medicare is good for cutting down on the costs involved with that. I think there's a lot more cost on a private scale, because they're doing a lot of different things, or because of, as Richard was saying, there's different insurance companies have different things and different ways they pay, and different you know, different things they cover or they don't cover, and that what adds to the cost. And now you have the hospital calling back to the insurance company and say, well, will you cover this? And they go to a different insurance company, and they don't cover it. We need to get more uniform, get a little bit more uniform when it comes to what and what isn't covered. I think that would also help to bring down the costs as well. So that's kind of where I'm at. Annette, are you back on with us?
Yes, can you hear me?
Yes, you hear me?
Yes, I do.
Okay, go ahead and just
You
talk.
know what?
Go ahead and talk.
This Medicare thing, like I said, I do believe that doctors have to be responsible for the uprising in Medicare, which further doesn't give a patient what it needs. What I did find out about Medicare and Medicaid is the doctors are not even reporting into the system of Medicare and Medicaid what they're actually doing for a patient. Let's say the patient has high blood pressure, diabetes, heart conditions, etc. They're supposed to be putting their findings, everything in a database. Doctors don't even do this. Doctors just simply just take the money and run. And I believe that we need an overhaul on the reporting for doctors. And how I know this, my father passed away about 2 years ago, but he was one of the unsung heroes of the PGA of America. They didn't give him any food, no water, or anything. He had no pain. It concluded when I got his medical records, and this is why he was alive, that they had no pain. They were trying to make him have pain. They gave him, morphine, and he didn't even need morphine. So the doctors are doing a lot of things these days to patients to really expire them. And that's the hard part of everything, to me. The reporting, the fraud, waste, and abuse, and that's really key for me.
Thank you, Annette. Anybody else would like to chime in? Alan, go ahead.
I say, well, if you go to more incentive for people to control costs, more individual responsibility, but we don't break anybody in the process. What HHS could do is put on their website. If we get to a situation where it becomes like LASIK and cosmetic surgery, where people are actually concerned about what things cost, HHS could put on their website, for a particular medical problem, these are the typical means of treating it. So, for example, if you broke your rib, which I did once, and I remember this was back in the 80s, and I talked to a nurse, and she said, well, you can come in and we'll put some bandages on it, but it's not going to do anything. There's really nothing we do for a broken rib. So, but if HHS could basically have on their website, these are the ways of treating a broken rib, or if you have acid reflux, these are the common ways of treating them. And people can do their research, and when they talk to providers, they can ask, how much do you charge for this? How much do you charge for that? And if people have incentive to control costs, if we start seeing commercials about, people in the healthcare industry, other than things that are not covered by insurance, that will be the sign that success is starting to be realized. Because if we can get costs to come down, that's going to cause Medicare costs to come down. It's going to cause Medicaid costs to come down. And that's going to help solve a lot of these financial problems of the federal government that I mentioned, because a lot of them are driven by Medicare and Medicaid. Social Security is the biggest ticket in the federal budget at over $1 trillion a year. And that number is only getting larger as we add baby boomers. Each day, about 10,000 rolls. That's going to go on, for many more years. And like I said, our system just doesn't work on a long-term basis. So, just wanted to make that little point there.
Richard, would you like to add anything?
Yeah, I just want to add, now admittedly, healthcare costs for such programs as Medicare and Medicaid is a very substantial part of the federal budget. Keep in mind also that the healthcare costs that private individuals incur is a tremendous part of their own household budgets, and much more so than in any other country in the world. So when we're talking about the problem of cutting healthcare costs and bringing them to be in line with other nations. We're talking about something that is going to be of tremendous value to both, let's say, the public budget as well as personal budgets. One thing I also wanted to add is that, in a time of pandemic, I think it's pretty clear that the health of everyone in some respect depends upon the provision of health care to literally everyone, and not just within our own borders, but elsewhere in the world. And that if there are people who are not able to get the health care they need because they can't afford it, or there's not enough of an investment in health care to have it available, we're all in trouble. There are going to be more pandemics. Climate change is putting us into contact with animal species that were in different habitats. And 75% of new diseases are caused by animal to human transmission. There's a big problem looming ahead of us of microbes that are resistant to antibiotics. And that's going to cause big, big problems. We need the kind of public investments and worldwide initiatives to contend with these things and make us safe. So we don't do that, our healthcare costs are going to go through the roof in a way that they won't if we really keep things in check as they should on a worldwide basis.
I agree with Richard that, it's a huge strain on the federal budget between Medicare and Medicaid, and every individual except, here's the group that you're looking at that you have to overcome. Everybody outside this group comes out ahead if healthcare costs come down. And the group are a number of doctors. I had a colonoscopy last week. I mentioned a doctor that I was running for Senate. He said, "Oh, I'll look at your website, blah, blah, blah." And I thought, well, the guy will probably send me an email. No. And I think the reason why is because my healthcare position he probably didn't like, because he's basically running a factory there. He's probably doing 2 to 3 colonoscopies an hour at $1,000 a pop. He's probably making $1 to $2 million a year. Does he want to see that gravy train end? No. So you got doctors, not all doctors, but just some of them. You got health insurers and their shareholders. You've got hospital companies and their shareholders, and you've got drug companies and their shareholders. So it's that subset of the population that's up against everybody except doctors and these shareholders that I talked about, the people who work for these companies, drug companies, health insurers, and hospital companies. So you would think that the balance of power would say, well, the federal government's finances and all of individuals who benefit from these entities would outweigh. But and they should, and ordinarily they would, but the two major political parties have sold out to drug companies and to health insurers and hospital companies and to the AMA, and that's why nothing gets done.
Annette, would you like to chime in on anything? Annette, unmute yourself.
Yes, I'm here. Yes, I'm here.
Go ahead and chime in if you like.
It's so amazing. It's so amazing to me that we haven't solved this issue. But I think there needs to be a blueprint nationally for how doctors are really accountable to citizens. It's so very important. And this is why I say that they need to be accountable in this particular Medicaid and Medicare registry, because a lot of money is being abused in the system. Simple vitamin D, simple immune system work, instead of big pharma and shoveling pills. And now that we know that all of our pills came from China and we're trying to move this in-house, we have to really look at our healthcare system versus our managed care system. I believe that when we do that comprehensively, and we care more about the patient than we do the profit, we're going to be fine.
All right.
Could I chime in on something Alan just said?
Yeah, go ahead.
I don't know if
Go ahead,
you
sir.
wanted to come in.
Go ahead, Richard.
I think you made a very important point about how the two major parties. Can you hear me?
Yes, sir.
Yes. Okay. Now, you mentioned how the two major parties have sold out to the healthcare industry, pharmaceutical companies, and I think that reflects a big problem just concerning how we allow such companies to contribute large amounts of money to political candidates. And on the other hand, also offer them extremely high-paying consultancies and positions when they rotate out of office. And I think these are two sides of a kind of political corruption that we need to contain with reforms that really put the lid on campaign contributions by private corporations to candidates, and also some kind of controls over what a candidate is able to do when they leave office, so that they don't simply obtain a very lucrative job in an industry which they have been favoring while they've been in office, and then get their payout as soon as they leave office. And I think these are problems of how our political establishment operates in both parties. And we need to take measures, and that's part of why our healthcare costs are so out of line with the rest of the world.
And you know what, that problem you mentioned is particularly bad in the military, where a lot of generals retire and they go and get jobs at these national defense contractors. I say defense loosely. Let's face it, we kind of dominate the rest of the world. Most of it isn't about defense. It's about whatever you want to call it, 800 foreign military bases. Let me say that PACs basically work is they don't make donations to campaigns. They just run commercial candidate. They just want that out. So. But still, that candidate then owes whoever that PAC is, and a lot of companies have their own PAC. It's not the company PAC, it's a foundation that'll somehow, everyone knows they got the company's name on it or whatever, and everyone knows it's the company PAC.
Yeah, that's very important.
Yeah, I think the big thing in healthcare obviously is you follow the money, and you follow the money. Which politicians are getting what from whom, and where the legislation is going based on that. I think if you follow the money, you can follow where the legislation is whether it's going to succeed or fail. And I agree that both the Republican Party and the Democratic Party have sold it. You know, they've sold the American people down the drain when it comes to healthcare as well as other issues. That's why I'm running as a third party independent with the Libertarian Party as well as the Constitution Party, because I think we need somebody who's up there who's actually got a fresh face, who has got a fresh perspective, and someone who can actually shine a light on it, because the best thing is sunshine on a place like Washington D.C. is you shine a light on what's going on there, and the roaches will go back to where it's at, and then you can follow them back and get to the meat of the problem. So, anybody else like to comment on anything? Okay, we're all finished on the healthcare end. Because of the death of Ruth Bader Ginsburg, I'd like to get a few short comments on that. Obviously, she just passed on Friday, so condolences to her family. And, where do we go next? Well, obviously, if you follow the Constitution, the president is under a constitutional authority to appoint somebody to be to go through the nomination process, to be either accepted or rejected using the advice and consent of the United States Senate. 27 times, I believe, that this has happened during a presidential year, when the president and the same party controlling the Senate are of the same party. It's happened 29 times. 27 of those times, the person has been approved. When it's been of the opposite party, I believe it's only 2 out of 10. So I believe that President Trump should nominate somebody, and that the Senate should go through advise and consent, and find out whether or not that nominee is worthy to be on the Supreme Court, and vote up or down. I think that's what's required. So that's what I would do. Is I would listen to whoever the nominee is, and listen to their views, and make sure that they are competent and someone who you would be proud to have on the Supreme Court. That's kind of where I'm at. Richard, would you like to go?
Yeah, I mean, I think you're right. The Constitution certainly says nothing about the president not being in a position to provide a candidate for appointment to the Supreme Court, even to the very last day of the president's term. And then it's up to the Senate to give its advice and consent on whether to approve it. You know, I think Mitch McConnell was going against that, and it may be hypocritical that he and other Republicans now want to go ahead after having argued that they shouldn't. But nonetheless, the Constitution gives the president and Congress the right to take up a new nominee, as long as the president is in office. But I think we do have this problem of a kind of politicization of the Supreme Court. And, you know, the Supreme Court has come to serve as a kind of authorizing power, which any constitutional government requires. In other words, you can't allow the legislature to make whatever it legislates count as law, any more than you can allow the executive to do whatever it wants without being subject to some kind of authorization. And the Supreme Court has come to play that role. But it's hampered in the sense that, you know, you have lifetime appointments, which were in a way supposed to insulate Supreme Court justices from being subject to outside influence. But in a way, what it means is that a particular administration can, if it, so to speak, lucks out with people leaving the court, it can lock in the Supreme Court to justices that represent its particular viewpoint, and they may be there for decades to come, irrespective of how political events transpire. And I think that is not necessarily good. I think we should have a system where not only Supreme Court justices, but federal justices in general should have fixed terms. They shouldn't be renewable. Should be one term, maybe 10 years. They should be staggered so that no particular administration can really fill the courts in a way that's going to define how the courts operate for decades to come. And I think it turns out this doesn't require any constitutional amendment. Article 1, Section 1 of the Constitution gives Congress the power to determine how the federal courts are structured, administered, and run. So I think it's time to think about that seriously and see how we can change the composition, the nature of the terms and the like, so that the courts can be as optimally independent as possible and still be accountable. And I think that requires some of the reforms I'm suggesting.
Alan, go ahead.
I think President Trump has the right to put up a nominee, and I think he will, and I think she or he will probably pass muster with the new majority rule that McConnell put in. It used to be 60 votes. That'll probably come back to bite the Republicans at some point. But, you know, one of the problems with, I think that Richard had a good point about judges being appointed for life. And I had a case once where I had a judge in his mid to upper 80s. And he was mentally still there, but you knew his clerk was actually making a bunch of these decisions. He was, you know, he was writing opinions, and his clerk had been with him for decades. And it's sort of like, I remember when I was a teenager, I used to do gardening work for this woman down the street. She was in the mid-80s, and she'd say, "Oh, we need to go take my Cadillac to go, you know, buy some more bulbs." And it was like, you know, it was the scariest thing in the world to drive with her. She was all over the road, and it was like, you know, I was like, am I going to make it through this? And hope none of my friends see me. But at an age, they needed to be taking, you know, tests to prove that they're both with it. And it's like anyone, you know, I think, you know, Joe Biden, for example, I think he was a good person. I think 10 years ago, he would have been a great candidate. I don't think he's mentally all there personally, and I don't like Trump. Mainly from a personality perspective. But one thing a lot of people don't realize is the Supreme Court hears about 1 out of every 50 cases that are filed with it. I filed for certiorari in a case a couple of years ago, and it was denied. And I know of no one who personally, I know one guy who had a case taken, but it was back in the 60s. It's next to impossible to get the Supreme Court to hear your case. They'll hear a Roe v. Wade, and they'll hear, about Trump's tax returns and whatnot. But a lot of your really big issues don't get picked up by the Supreme Court. So, but everyone has an appeal right to a circuit court, U.S. Court of Appeals. One of the problems we have now is the D.C. Circuit. I've got a case that's up there, is heavily pro-government. And, Merrick Garland, I have him as one of my judges. Better watch what I say here, of course, but he is very pro-government. That's just known, it's just understood. And you have basically two types of federal judges when you have a case against the federal government. You have those who try to be fair and don't favor the federal government, and those who favor the federal government. And the problem I have with a lot of Democratic potential nominees to the Supreme Court is they're going to put in judges who are going to favor the federal government. I like Gorsuch because he doesn't favor the federal government. I like Kavanaugh because he doesn't favor the federal government. Thank you.
Just want to add one thing when you're talking about McConnell adding the 60 vote thing. It wasn't McConnell, actually. It was Harry Reid in November of 2013. They dropped the 60 vote rule so they could approve more appellate judges for President Obama at the time. That's who actually dropped the filibuster rule. And they said at the time, by doing this might come back to bite you, and it's pretty much doing that. So actually, it was November.
I read the paper was McConnell, but you may very well be right.
No, it's Harry Reid. Harry Reid, November 2013. But yeah, they did it because they wanted to be able to appoint more appellate judges, and the 60 vote thing was blocking everything. So that's the reason why they did it. They call it the nuclear option. Annette, would you like to chime in on the Supreme Court?
Oh, yes, I would.
Go ahead.
Well, first of all, I have to give credit. She's a woman, and I'm a woman. So I have to give her credit for being the second female on the Supreme Court. I would hope my daughter, who's 20 years old, looks forward to that. She's in pre-med at Georgia State. But, she said she wanted to go to law school too. But so I commend her on that. As far as, having term limits to the Supreme Court, it's not broke. So we don't need to fix it. We just need to continue with the process that we have. I believe that we have a great process. What comes into play is the Democrat versus Republican, but we have to look at the Constitution. What does the Constitution say, and how does it protect the people? Because it's supposed to protect the people. Even the Declaration of Independence, even the Bill of Rights. That Supreme Court is a juggernaut for the nation and even for other nations. And I think other nations are envious and jealous of the United States of America as it relates to the American Republic, while we still remain under the Republic, the democracy. So I'm going to give her kudos for her life. And it's so funny that she was born in 1933. And 1933, that was the same time that the United States of America went bankrupt. So, she was there at a time very young and eager, and we just have to look at our nation and realize that our infrastructure is really sound. Can we build upon it? Yes, we can.
All right, thank you, Annette. Anybody else would like to comment on any other things?
It's like to say in response to that, our infrastructure financially is not really sound. It's the 100% opposite of sound for the reasons I've given. The GAO said our debts are going to spiral out of control. They've tripled since then. This doesn't work long term. So, and the Constitution doesn't say anything about having a debt or not having a debt. And it's kind of surprising because Alexander Hamilton knew all about debt. And I think he thought overall debt was a good thing, but Congress was given the power to regulate currency, and they turned it over to the Fed. And so now the Fed is printing money, basically to pay debt. So got to a point where it's not a sustainable system due to finances which aren't covered in the Constitution. So just like to point that out.
I'll point out another infrastructure it's lacking, which is
well, I would like to say something about that, and the point is one of the reasons that I'm running for United States Senate is to reignite the gold standard, because we need to put the gold standard in place to stabilize our country as well. But we've done a great job. We are the reserve currency to the world, and I think that once again that's why the world envies us. The President of the United States is working on the Federal Reserve, and I believe after a while, the powers of the Federal Reserve won't even be there. So give us a little time, but I believe that we're going to stabilize our country with gold. And of course, that's why you see a corn shortage. It's coming, I promise you.
There is a 0% chance that you're going to go to the gold standard. Zero. Not realistic. It's not going to happen. So Trump wants to put in this Shelton because she wanted to reduce interest rates last year to 50-year low in unemployment when the Fed rate was at like 2, when it should have been at 5. So I think she would be a mistake. But once again, Trump likes her. So most of these, let's face it, a lot of these Republicans up there are Trump patsies. They want to do whatever it is that makes Trump happy. Loeffler and Collins are both Trump lapdogs, and that's, I hate to say it, but that's what they are. They both want to worship him. They both are going to do whatever he wants, and half the things he does, in my opinion, are all right, and half of them are all right or good, and half of them are disastrous, including the debt last year, $1 trillion, when we were at a 50-year low in unemployment. So.
Okay, anybody else want to chime in on anything?
Oh yeah, I have to say something. Let me tell you, the President of the United States is saving our country. We are not going into socialism. We are not going into communism. We are not going into the things or the rudiments and the bad habits that other countries are trying to get us into. We have the Commander-in-Chief who's been picked for a time, sent as this by God. And we all have to really pray about that, and we pray for our leadership. I don't ever want to be somebody running for United States Senate that does not honor the placement of the President of the United States. And I believe that if we look deeper, we'll see that we are saving America. We're saving our one nation under God, indivisible and justice for all. So I am thankful.
I was just going to say, I'm not going to tell anybody what to pray for. I think that's beyond what this position that we're all running for should trying to do. I think Donald Trump, like I said, has good points and bad points. His negative points are very bad. So his personality, can't get anything done with foreign nations because everybody hates him. That's just because he's selfish. He's just a bad person. Couldn't care less about the environment. He's financially destructive to the country. And again, he does have some good points. And put in some good judges, Gorsuch and Kavanaugh, reduce regulation. And I've got a list of pros and cons, but I don't think he was a godsend to help this country. I'm sorry.
Okay, we're at the end of our discussion. Everybody's gonna get a chance. 2 minutes. Kind of time yourself. I'm not gonna be a big judge here. We got time, but take about 2 minutes. Why people should vote for you. Tell them information about your website and how they can get a hold of you. And I think we'll go. Let's see. Let's go from the middle and go out. Annette, you can go ahead and give 2 minutes. Who you are, why you're running, why people should vote for you. Go ahead, Annette. Unmute yourself.
My name is Annette Davis Jackson, and I'll tell you, I love running for United States Senate. And the reason that you should vote for me is because you've never had to vote for a Spelman graduate who went to a historically black college. And while we're talking about Black Lives Matter, let's denounce that. Really, historically, women and men who went to historically black colleges, they have also the right to take one of the top positions in the state, and that's the United States Senator. I hope to work with the president with the gold standard. I hope to work with the president with establishing the Ministry of Youth, Sports, and Seniors in the United States of America, because our youth need to be tied to the wisdom of our elders, and we need to increase recreation facilities to the state of the art so that we can continue to build our healthcare, to build our strength, and more importantly, we have to be kind to each other. The black and white racism, I didn't grow up in that. My father was one of the unsung heroes of the PGA of America. I grew up on golf courses playing tennis, having a good neighborhood in West LA, California, and then coming to go to school in Georgia. And it's still the North against the South. Abraham Lincoln did so very well. He said, look, I'm not even going to the coast. I'm going to write the Emancipation Proclamation. And the reason I'm running is I want to write the blueprint for the state of Georgia, where we have a polished Georgia in America, in Georgia, and everybody put the shoe shine on their image in healthcare, in education, in facilities, in facade development, in curb appeal, in the way that we act towards each other, and in behavior. My name is Annette Davis Jackson, a candidate for United States Senate. Thank you.
Thank you, Annette. All right, I will go next. My name is Brian Slowinski. Brian Slowinski. Brian Slowinski. Now, why do I say my name 3 times? Well, I'm running as a third-party candidate. I've been endorsed by the Libertarian Party. I've also been recommended by the Constitution Party, and I'm doing my best as a fusion candidate, a consensus candidate, to bring about independents and third parties to support my campaign, to work to have somebody go up to Washington, D.C. that's not part of the process. I'm not part of the swamp. I'm not part of the Democratic establishment. I'm not part of the Republican establishment. Right now you have red versus blue, and they're constantly fighting, and not much is getting done. We need someone up there who's actually going to tell the truth, who's going to basically shine a light, put some sunshine on what's going on up there. That's why, if I'm lucky enough to get elected, I would make sure that every vote is recorded, that we would go back to a budget process to get away from these omnibus garbage bills, which are basically one vote, and it's basically written by a few people and lobbyists in the back room. I would go back to a regular budget process where you have 12 spending bills. With those 12 spending bills, it allows the senators and representatives to make amendments, to vote back and forth on this, to make deals which would help to pass it, make it better. And then you can also make amendments and vote on it on the floor. So it's not just being written by a few in the leadership or a few people that have been tasked to do that. That's what I bring to the table. I also bring to the table that I'm someone who works to bring people together. But also what I would do also is right now is a perfect example of why you need somebody up there who's more independent. Like I said, November of 2013, Harry Reid dropped basically the nuclear option when it comes to appeals judges. To basically only need 50 votes in order to approve them. Now this is coming back for the Supreme Court justice, and I believe whoever the president will nominate more than likely will be put on the court. I think we need to go back to our original. That's what the filibuster was put in there for. That's what the original rules were put in there for, to basically help the minority when they're in the minority. And as someone, obviously, if I get elected, I would already be a majority of one, but I'd still be in the minority. And you still have the ability to be able to object to people or bills that you think are objectionable and work around that. There's also 10 other things that you can do as a United States Senator, whether it be secret holds or making them actually read the bills, objecting to unanimous consent. So if they're not doing their job, you slow down the process and get them back on task. That's what I would offer. Again, my name is Brian Slowinski, and I appreciate your vote. You can get a hold of me on my website at www.voteslowinski.com. That's VOTESLOWINSKI. Thank you. All right. Alan, you're next, sir. Go ahead. Alan, you there? Alan?
Yeah, thank you.
Go ahead, sir.
I just want to say to yes, can you hear me?
Yes, sir.
Yes, I want to say to patriots and young people, can you hear me?
Yes, sir.
Okay. If one of the major big name candidates what? Can you hear me? Okay. If one of the major big name candidates with all the money wins, nothing is going to be accomplished in this race. You know, Kelly Loeffler, Doug Collins are going to do whatever Trump wants. On the Democratic side, Mr. Warnock has no positions whatsoever on his website on any issues at all. It's a shame that he's even considered yet because Stacey Abrams has endorsed him. He's the Democratic frontrunner. He or Lieberman, who also has virtually nothing on his web. If any of those people get elected, nothing gets accomplished in this race. Nothing. The way something gets accomplished is someone who's not a Republican or a Democrat wins. Anybody who comes in as a Republican or Democrat, no offense, Richard, I like you, is going to be put in the back of the bus by the major party and said this is how it's going to be. In contrast, if an independent gets up there, or libertarian, or someone who's outside the two major parties can actually get something done, particularly when you get in these close vote situations. If you look at the the candidates who are outside the two major parties, and you look at my website, buckleyforsenate.org, I think you will come to realize that I am the best candidate in terms of ideas, solutions to problems, because I've thought through these problems for many years. I propose a much simpler tax system that I've come up with over the course of 3 years. I do tax and pension and estate planning work for a living. So I understand the system, unlike most of these people the vast majority of these people up there don't have a clue how the tax system works if they vote on these things. I propose reforms to entitlement, cost cutting, real cost cutting, freezing federal wages until they're 10% below their private sector counterparts, while increasing the pay of professionals who work at the government until they're 10% below their private sector counterparts. Reducing foreign involvement, real solutions to problems. Again, I'm the only candidate who actually does these things. That may not be appealing, I understand, but I do propose a system that is sustainable. Unlike everybody else in this race, I've thought through all the financial issues, and yes, to make our system last, it is going to require sacrifice. Not radical sacrifice, but reasonable sacrifice. Again, I'm Alan Buckley, buckleyforsenate.org. I would appreciate your support and your vote. Thank you.
Okay, Richard, you're up next. Go ahead, sir.
Yeah, my name is Richard Dean Winfield. I am running as a Democrat, but I'm not a Democrat who wants to do business as usual. I'm not the darling of the political establishment awash with money and press attention. I'm instead an upstart who's determined to transform the Democratic Party from within and also transform our nation, and to make it really fulfill the promise of our democracy, to be a bastion of freedom, to fulfill the American dream, where everyone really can manage to stand on their own feet and have a decent living and be able to exercise all their freedoms with a government that is a facilitator of all of our rights. We now stand on a precipice. This election is the most important in our lifetime. And it's one whose very existence is threatened by a president like no other that we've experienced, who has told us he wants to put off the election and then tells us if it takes place and he loses, he will not respect it. And I think we have to fear for the very continuation of our democracy. Of course, the problems we're facing that have culminated in Trump have not been produced by him. They're the product of a neglect on the part of both parties of really dealing with the social rights that we've ignored, the rights which allow us to escape domination and blockages of opportunity in society and in the family. And unless we can overcome these blockages, we can't exercise our freedoms as self-governing citizens. I'm here to provide the solutions. I have devoted a lot of thought to what they are in my 40 years as a philosophy professor. The culmination of that work is to be found in the libraries of the world. I've also recently published a couple of months ago a book of political policy called Democracy Unchained. I invite you to listen to my podcast, America Unchained. And I invite you to go to my campaign website, winfieldforsenate.com, where I lay out in detail policy solutions to the problems we are facing. We need to have a new birth of freedom. And the solutions for that are not really fundamentally new. It's a matter of recovering the call for a new Bill of Rights, the call for providing, in a sense, a genuine equal opportunity at all levels of our society, not in terms of equal outcomes, but in terms of equal opportunities, so that we can all exercise our freedoms as citizens of a body politic devoted to the common good. So I urge you all, make sure you register, make sure you vote by mail, and make sure the votes that you send in do get registered. Everything is at stake in this election, and you need to listen to some of those voices that do not have the money to reach everyone's ears through political ads on TV and sound bites. I hope you will make the effort to see what we really stand for in detail. So thank you. Richard Dean Winfield, winfieldforsenate.com.
Thank you, Richard. Thank you, Alan. Thank you, Annette. With this, I want to thank everybody for listening and participating. Sorry about the glitches. That's what happens when you work with computers sometimes and the internet. It sometimes doesn't want to work with you. Again, thank you for participating in this. We'll be doing this again next Monday, same time, same bat channel at 7 o'clock. And I want to thank you thank the participants again. In alphabetical order, we have Independent Alan Buckley. Say hi. We have Annette Davis Jackson. Say hi. You there, Annette? All right. Then myself, Brian Slowinski. Hi. And Richard Dean Winfield, the Democrat. Say hi.
Hi. And
So,
until next time.
Till next time, thank you. Appreciate it. We're out. Thank you.
Thank you, Brian. Thank you, Alan.
Thank you, gentlemen. Annette, are you there? Annette? Annette, are you there? Hello, Annette? Annette, are you there? Annette, are you there? She's not there. You still there, Alan? You gone. Annette, are you there? Guess not.